This blog is thinking about community in a different way. Within the province of Saskatchewan, we have a number of individuals who are living in secure environments. Corrections Service Canada has a number of institutions across the province, and here in Saskatoon, the Regional Psychiatric Centre does have a large health services component. The mission of that centre is improved offender health that contributes to the safety of Canadians. For this blog, we're going to dedicate it to the opportunity for you to listen to one of our students' experiences there, a new graduate from our NEPS program who has joined that team and is now in a managerial role, a number of our faculty who work at the center and conduct research, and also Angela Weber, who is the Associate Clinical Director. Something that I wanted to ensure that you were aware of is that this summer, for the first time, RPC will offer a Senior Assist program. So if you are a student who's interested in developing relationships with your clients, in learning to improve your communication skills, and in interacting with individuals and their families that have different life challenges, then this may be an opportunity that you wish to consider. You will see the names of the individuals who are working there, and Angela Weber's information in terms of how to contact her for the Senior Assist program. You can also email me directly through the blog, and I can forward your name to Angela Weber if you are interested in pursuing that clinical opportunity. So I hope that you enjoy this blog. Certainly it has been a learning experience for me to participate with our faculty at RPC and to experience the interest that the department there has in nursing and in contributing to our learning opportunities for nursing students.
So I'm a staff nurse at the Regional Psychiatric Center. I really enjoy forensic nursing because it's different than anywhere else I've ever worked. Every day is a new day, a new experience. It's lots of hands-on, lots of talking.
Yeah. I really enjoy like the mental health aspect of it, where you get to work with the men and you get to, well, I worked with the men at the regional hospital, and you get to talk with them and deal with a lot of mental health issues. Like, I think I dealt a lot with borderline personality disorder, schizophrenia, some behavioral issues like conduct disorder, things like that.
To recognize the population that you're dealing with, and that, you know, dealing with a non-compliant diabetic in a secure environment is different in a lot of ways than dealing with a non-compliant diabetic in the community or in the hospital, because they're probably non-compliant for different reasons in a lot of times. So whether it's related to the mental illness or whether it's related to their just behavioral issues of being a prisoner or a federal inmate, significantly impacts their stability in both the physical and the mental health.
So for students who might be thinking about going to RPC for a clinical placement, what would you offer them as someone who's just completed a rotation there?
If you're interested in mental health and forensic nursing, I would say definitely go there. It was my #1 choice, and I'm really glad that I did it. Just because of it's just a whole different kind of experience than the hospital, because I've had clinical placements in hospital settings, and this was just very different, dealing with behavioral concerns, and like you still do get to do the physical care as well, so you get like a whole broad kind of aspect. It's really interesting.
It kind of depends which area you want to go to, because there is a regional hospital where they do more of the medical stuff, and then there's also units like Mackenzie where they have more anger programs which require more counseling and require more education sessions. And there's also the school program there. There's so many areas that you could actually really get involved into RPC. I almost do feel we get to actually have more relationships with the people, which is kind of what I was really looking for. They're not there just for a week to
kind of a captive audience.
Yeah, they're not there for a week to be on stabilized for medications. They're there for programming, so you really get to know someone. And
I think you have many more opportunities to develop your counseling skills and your group therapy skills.
And one of my other things is I do want to develop a relationship with my patients, and I found that in a hospital during my school practice.
The time
you
doesn't allow it.
Absolutely.
Everybody who's staff and students talk about correctional nursing and forensic psychiatric nursing. it takes me back to thinking about just what I thought about when I first got involved as well. And it is a whole entirely different area, and I think everyone is always so surprised at the opportunities that there are, the autonomy that's there in every area of nursing. And you're learning about the criminal justice system, and we were taught in nursing about the healthcare system, but to see how the criminal justice system works in Canada and how healthcare plays a part in it, staff nurses and student nurses didn't realize is that they'd be on the cutting edge of seeing things, not behind in corrections, because we saw AIDS and HIV far before the hospitals did and set those policies. And the same thing with the staph infections and Hep A and B and C and how those got to be so prevalent. So,
I think in a lot of ways, a lot of the students have reservations around security, and they're going into a federal prison. And so how did you feel about that once you were in, or before you even started? Did that play a role in your decision?
It did play a role in mine. I also was fortunate to have a practicum there, so I did get to see it firsthand. You do have to obviously be careful, because you have to. People kind of forget sometimes that they're in an institution, and these people really aren't your friends. You have to be very clear with your boundaries and your own comfort level. But I've never really had a situation where I felt really unsafe. Doesn't mean it will never happen, obviously. But
True anywhere.
Yeah, you just
Yeah.
you really can't be naive to the fact that they are inmates, and I think sometimes it is easy to forget.
Yeah, I think I had a challenge with that when I first started, because it was kind of difficult to think that they were inmates at first. And I remember my first journal, I was talking about having to set clear boundaries and say, like, I'm your nurse, I'm here to provide you with care, therapeutic interventions, and be careful at the same time. But I didn't feel unsafe at any point there. Of course, I was aware of my surroundings. And
Something that the nurses and students often struggle with is how do you refer to the person that you're working with, and technically they are federal inmates, and that is a correct term. But in your professional role as a nurse or a nursing student, you really are working with patients, and I think how you frame that and how you look at the person that you're working with helps you see your professional role more clearly as well.
How did you get past the whole point of I'm in a prison? Like, sometimes you may see names that you heard of on the news, or those kinds of things, to get past it and to know your job and what it is you needed to do when you got there.
well, I found that kind of difficult at first, because it is a prison, and you can tell that it's a prison when the doors close and everyone has to lock up 3 times a day. But I found that it looks more like a treatment center, especially in the regional hospital. So I think that's what made it a little bit easier for me. Mm-hmm. The fact that we provide them with nursing care. They're also sick there in the regional hospital too. So it's a lot easier to see myself as a nurse rather than just working in a prison.
It could be any safer. It's really a safe place. It's our families, I think, that worry about it. But
Why do you want to work there? Those questions like, why do you want to work
there?
there?
Couldn't be any safer. It's probably one of the safest places.
And I know that was an issue that came up years ago when we first started placing students at the Regional Psychiatric Center, was that whole issue about their safety, and is this a place where colleges of nursing should be placing their students. But we've had a long history of placing students very successfully with the Regional Psychiatric Center, and we've had an ongoing collaboration, and we have our Custody and Caring Conference that will be here in September of this year, and students are always welcome to attend that conference as well. And also the opportunities that exist for our faculty to come and do in-services at the Regional Psychiatric Center, to have you or your staff at the center come and provide some guest lectures for our students. I mean, I think there's a real reciprocal kind of relationship that exists.
Angela, we talked before about research opportunities that might be for students and the staff to get involved in the college. Can you think of any that we could perhaps get off the ground straight away?
Oh, specific projects, they're probably endless, really, and for the students in particular, well, and all over, is that I don't think people realize that we have a research department right here at RBC, and with your involvement in the committee, as well as psychology and psychiatry, there's endless opportunities, particularly because our patients here are here for a lengthy time. There's lots of records, and there's so many things that we can look at and be able to have growth in our area.